Hi all. Today I'm going to present the second phase of the nursing process, which includes nursing diagnosis and planning. So these steps helps nurses to identify patient problems and develop appropriate care plans to achieve positive health outcomes. So assessment data leads to nursing diagnosis. So after collecting patient data during assessment, nurses analyze the information to identify health problems. So this leads to the nursing diagnosis. So once the diagnosis is made, the planning phase helps to establish goals and interventions to meet the patient's healthcare needs. So, diagnosis and planning bridge assessment with the patient care. So, next we move on to the nursing diagnosis. So, what is nursing diagnosis? So, nursing diagnosis is a clinical judgment about a patient's responses to actual or potential health problems. So, unlike a medical diagnosis, which focuses on disease, a nursing diagnosis focuses on how the patient responds to the condition and what care is required. Example, a patient with pneumonia may have a nursing diagnosis of ineffective airway clearance. So, nursing diagnosis focuses on patient response and not diseases. So, next components of nursing diagnosis. So, nursing diagnoses are commonly written using the PES format. That is, P stands for problem, and then E stands for etiology or cause, and S stands for signs and symptoms. For example, acute pain related to surgical incision as evidenced by verbal reports of pain. So PES format provides a structured nursing diagnosis. So next we move on to the types of nursing diagnosis. Here we have four major types of nursing diagnosis: actual diagnosis, risk diagnosis, promotion diagnosis, and then syndrome diagnosis. So actual diagnosis identifies the existing health problems, whereas risk diagnosis identifies potential health problems. Health promotion diagnosis focuses on improving well-being, and then syndrome diagnosis refers to a group of related diagnoses that occurs together. So each type helps nurses to provide individualized care to the patient. So next we move on to the NANDA classification of nursing diagnosis. So NANDA International provides standardized nursing diagnosis used worldwide. It helps nurses communicate effectively and maintain consistency in patient care. Some NANDA domains include nutrition, activity and rest, safety and protection, comfort and elimination. So NANDA provides a common language for nursing care. So next one is the diagnostic reasoning. So diagnostic reasoning is a thinking process nurses use to identify patient problems. So the diagnostic reasoning have the following steps. So first one is the collecting data and then analyzing informations. So the data collected or analyzed, then identifying patterns, interpreting findings, and formulating the nursing diagnosis. So critical thinking plays an important role in this process. So next we move on to the planning phase. Planning is the third step of the nursing process. During this phase, nurses establish, prioritize, set goals, determine expected outcomes, and select appropriate nursing interventions. So planning provides a clear direction of patient care. So next one is the priority setting. How we can able to prioritize. Not all patient problems require the same level of attention. Therefore, nurses must set priorities. Life-threatening conditions are addressed first, followed by safety concerns and then other healthcare needs. Maslow hierarchy of needs is often used to determine priorities here. So life threatening problem is the first, safety is the second, and patient preferences is third base priorities. Then goal formulation. Here, goals describes what the nurse and the patient hope to achieve through care. Goals should follow the SMART criteria, that is specific, measurable, achievable, realistic, and time bound. So, a well written goal helps to evaluate patient progress. For example, the patient will maintain oxygen saturation above 95% within 24 hours with the help of the interventions, medical interventions. So, next we move on to the expected outcomes. Here, the expected outcomes are measurable statements describing the patient's desired response to nursing interventions. They help determine whether the goals have been achieved or not yet achieved. So, expected outcomes should be clear, observable, and patient oriented. Example, the patient will demonstrate proper breathing exercise by the end of the shift. So through this they can able to maintain the oxygen saturation. So this is for ineffective airway clearance. So next one is the nursing care plan format. So nursing care plan is a written document that guides patient care. It usually includes the first phase of the findings, that is assessment findings, and then nursing diagnosis and what goals has to be achieved and what has to be planned, and then intervention, nursing interventions, scientific rationale, and then evaluation. So these are the steps to formulate the proper nursing care plan. To summarize, nursing diagnosis identifies patient response to health problems, while planning establishes priorities, goals, expected outcomes, and interventions. NANDA provides standardized nursing diagnosis and nursing care plans, helps to organize patient care. Effective diagnosis and planning are essential for delivering safe, evidence based, and patient centered nursing care. Thank you.